6 p.m. The June 19th meeting of the CDA will please come to order. Would you take roll call, please?
Wayne Clark. Yes. Karen Gales excused. Don Namer.
Here.
Alderman Spelesky. Here. Alderman Haas.
Here.
Jason Metz.
Here.
Jerry Motter.
Here.
We have a quorum.
Thank you. First item on it, we have a motion to approve the minutes of the April 9th meeting.
Second.
Been moved for approval and second. Any further discussion? Not all in favor?
Aye.
Meeting stands approved. We'll go to new and previous matters. Annual election of chairperson and vice chairperson. Mr. Stevel.
Mr. Chair, I'd like to nominate Jerry Motter as chairperson and Wayne Clark as vice chair.
I second that.
Is there any more nominations? Any more nominations? I'll call the nominations closed. You have to vote. You can just vote on that, right?
Roll call. I mean, just
Just a motion would do.
Can we have a motion to?
Second.
Okay. All in favor of the motion?
Aye.
Opposed? Person stands elected. Thank you.
My condolences to the chair.
Okay. Item number one on discussion relative to the offer to purchase the property located at 1706 South 68th Street by Universal Healthcare in the 68th Street Mitchell redevelopment area. Mr. Stevel.
Thank you, Mr. Chair. As we've discussed previously, we received an offer from Universal Health Services for a proposed behavioral health hospital at 68th and Mitchell. We've talked about the 120-bed facility, 250 to 300 jobs. We'll get to the values in a bit. And they've offered the market price for the land. There'll be no tax increment financing provided to this project. It's market-driven in that sense, so no city property taxes. UHS, and I'll talk about that in a minute, is over a $10 billion company, probably the second largest provider of behavioral health in the country, with about 87,000 employees. The proposal is for a development of about $33 billion. UHS has been conducting door-to-door canvassing to inform the residents of what they're trying to propose, doing a good outreach program. Started in the first part of June. I had a neighborhood meeting that was well attended, June 13th, and then the introduction tonight of their proposal to the Community Development Authority. And then they'll make a presentation, and then we'll go into closed session and begin deliberating this. And then there'll be a public hearing on the July 9th of the Community Development Authority, and then it'll go to the Common Council on the 26th, or the 16th. The Plan Commission will also be taking a look at it on June 26th, but there will be primarily the special use and the site landscaping and architectural review. If the property if the building were valued, say, at just 40% of what the projected costs are, it would generate about $350,000 a year in property taxes. And with that, I'd like to invite UHS to make a presentation. Brian Randall, you'd like to introduce your team, and
Thank you. Do you mind if we sit over there?
Please do.
you're welcome.
Thank you to the members of the CDA. I'm Brian Randall, an attorney with Davis and Keilthau here in Milwaukee, 111 East Kilbourne. And I've been working with UHS on what Mr. Stevel just introduced as an offer to purchase and the application pending before the Plan Commission. So I'm pleased to be here with you tonight. And with me is Sheila Adams of UHS. We are going to be prepared to discuss a number of elements of the project and some of the operational details, as well as our community outreach. And so Mary Claire Lancer, who we'll call up in a few minutes, she has been working, as that schedule showed, the neighborhood, and we hosted an open house meeting last week. So for the better part of 3 weeks, really engaging with the community and talking to a number of the citizens and the neighbors. Also tonight, we have Tom Olenichik with Harwood Engineering. He is local and present if there are any technical questions, but we also expect more of those will come up at Plan Commission next week when we'll have the architects in town from Stengel Hill. They're out of Louisville, Kentucky. As Mr. Stiebel mentioned, we have on file the special use permit application and the site landscaping, screening, and architectural review applications. Plan Commission will review all those next week. And of course, before this body will be the offer to purchase, and that has been drafted. We presented to the staff, and I'll defer to them as far as when you'll need to go into all those details. But we're very pleased to have this opportunity to present you with that offer and invest in the city of West Allis and build what we think is going to be a very exciting and certainly a state-of-the-art hospital. With that, I'd like Sheila Adams to talk a little bit about UHS and its background and what we're looking to do here at the site at 68th and Mitchell.
Sure, I'd be glad to. Thank you for having us, and thank you for having me this evening. As Brian mentioned, my name is Sheila Adams. I'm the National Director of Behavioral Health Integration for UHS. I often joke that I think I have the longest title in the company, but basically my role is in development. I have a clinical and operations background, but specific to this project, I worked with the Milwaukee County BHD on the partnership and the collaborative that we created, and that has brought us here today to talk with you all about building a facility in West Allis. So just a little bit of background on UHS. We are one of the nation's largest, most well-respected healthcare companies in the nation. We've been in business for 40 years, and over that time, we've provided compassionate care to millions of patients. UHS has both an acute care division and a behavioral health division. Within our behavioral health division, we have over 200 behavioral health facilities in the United States, and I think the size of our platform is important as it relates specifically to the best practice sharing that occurs among our clinicians and our providers as we seek to provide the best care to our patients, and also benchmarking as it relates to quality and clinical indicators. Again, always refining our practices, our programs, and our services to bring the very best care to our patients that is possible. I would say that our relationship and work with the BHD, as we talked about, a potential partnership, was extremely thorough. It was very collaborative, and we worked together on this potential partnership for approximately 2 years before they made a decision to choose UHS as their partner and invite us into this community to build a facility and provide inpatient behavioral health services to some of their most vulnerable patients in the community. So we were very pleased to be chosen by the county to provide these services. I think you'll find, and you've probably heard others if you've talked to UHS folks, will say that we strongly believe that healthcare is local. And we have gotten to know a lot about Milwaukee and the county and our work with BHD. That was a tremendous benefit to us over the last 2 years, and we were thrilled to be chosen and invited by them into your community. Specific to this project, and I think you've seen some of this information on the slides, but we plan to construct a new state-of-the-art freestanding behavioral health hospital. It will be a $33 million project is what we project. It will be a 120-bed facility and expected to open in 2021. Within our facility, it's designed really with safety as our top priority always. But it will be a very therapeutic and inviting healing environment for patients and the families that we will serve. Our facility will feature 5 inpatient units. The units will be one specialized unit for adolescents, 1 for older adults, and then 3 separate units for adult populations. And that really allows us the opportunity to specialize certain programs and services to accommodate certain clinical presentations among the adult populations.
Sheila, if I
Yes.
may pause for there,
Please.
because one of the documents or one of the boards we showed the neighborhood meeting last week,
That's fine.
and it's in the Plan Commission file, is the floor plan, and just might be a good visual at this point. Sheila talked about the 5 patient units. So the way the building's laid out, we have, of course, Mitchell here, and 68th is down on this side of the building. But this would be a patient unit, and you have the nurses and the staff station here with visual access down the corridor and going to the next patient unit. So here's another patient unit, that's 2, here's 3, here's 4, and then here's 5. With administrative services, the food in the kitchen, the gymnasium, all that's kind of along the street frontage. So it presents as an office building, medical type of facility with more of the patient rooms in the back, with access to all the courtyards and the activity yards. So I just wanted to kind of, again, show that layout. We haven't decided where the adolescent wing would be, where the elderly wing would be, and the other 3 wings, but that's exactly how that would lay out within that facility. And as Sheila talked about, emphasis on safety and security. So we'd have a main access point here with the security staff and controlled access, as well as the outpatient access point would be right there. Just wanted to, if anyone has questions, of course, we can talk about that. We have the plan, site plan and landscaping plan, and some of the other renderings that we can go through as well.
So it's something we get asked frequently is how long are patients in your facility? Most of our inpatient patients are admitted for 7 to 12 days under the care of a psychiatrist and the clinical team, and then discharged to an aftercare provider in the community, so that we set the patients up to be able to sustain the gains that they made while they were in inpatient treatment with us. So that's a little bit about, I think, the facility itself and the programs. I think, more specific to what this will mean for the community. When fully operational, I think one of the earlier slides said we will provide employment to 250 to 300, members of the community. Our intention is to hire locally, to tap into local talent for a wide variety of positions, some of them clinical, physicians, nurses, social workers, pharmacies, that kind of thing, but many, many of them support staff, business office, receptionists, housekeeping, dietary, and the like. So just a wide variety of jobs will be offered to people in this community. And I also wanted to mention that the hospital will serve as a clinical training site, and that's very important to us as we think about bringing students into our facility, furthering our commitment to workforce development, but also we take great pride in training and investing in the next generation of clinicians.
And I think behind Sheila was one of the slides that our team provided to staff today. They were able to put that together, but just gives a quick summary of what the expected employment opportunities with benefits that we'll be having. And certainly recruiting local talent will be important because there is a need for good medical staff, and so that'll be part of the 2-year ramp up while this facility is being constructed, what the company will be focused on. One thing, just to loop back a little bit, Sheila talked about the relationship with Milwaukee County and having been chosen for the county partner. This is a 120-bed facility, though, and so we are going to operate as an independent and a private facility that will have that county service, but it's not simply a county facility, or we'll have a broad base of referrals coming in from all the medical providers out there, including the county. So we just wanted to explain that a little bit, and certainly there are questions we can go into more details, but certainly the relationship with the county is very important. With that, I'd like to introduce Mary Claire Lancer to join us up here, or I can give you a spot here. Mary Claire has been working the neighborhood, as I said, walking door to door and hosting our neighborhood meeting, and so she has a couple of summary reports that she'll talk through, and we'll give everyone a
Should I
copy.
pass those around?
That would be great, thank you.
Maybe wait just a minute.
Okay.
So, we met with staff early on, and Jill was kind enough to give me a 5-page Excel spreadsheet of who in the neighborhood should be contacted. So that became, kind of our marching orders. My associate Chris Korjenik and I visited people on June 1st, June 3rd, June 7th, 8th, and 10th, concentrating on the Saturdays and evenings during the week when the weather was decent. This is what we used when we went door to door, and I was pleased to tell people that what's in here is the actual application. This is exactly what was submitted to the city, and they could look at it in whatever level of detail they liked. I told them I wasn't here to razzle-dazzle anyone. I was here to provide as much information as they wanted and to write down their comments on index cards like this. Very low-tech, but very appreciated by people who saw that I was listening, I was writing things down, and I told them I was gonna respect whatever it is they had to say. I just really appreciated their letting me tell them about what's being proposed and answer questions that they might have. This was a little easier for me than it might be for others, because I'm a nurse. And I've worked in behavioral health facilities in the past, so it was kind of going back to my roots. I started with properties that were nearest, right across the street on 68th Street. And if I didn't find them there on June 1st, I came back and saw them again on June 8th, because I think it's important to start there. As we were going through this, it became evident to me that the information meeting invitation that I was handing out to people was really going to a lot of renters, and that property owners who didn't live on the property might not understand that there was a meeting coming up because they wouldn't get notice until they received the public hearing notice. So at that time, I mailed, first-class mail, 108 invitations. So these, I think, have you all seen the invitations?
Yeah.
So they all got that. So it's estimated that 455 invitations were distributed. 106 were handed to people door to door, because that's how many people Chris or I spoke with one-on-one. 241 were left in plastic door hanger bags like this if we didn't find people home. And in duplex situations, for instance, if there was a back door, a side door, and we could get to it, we'd put these on there too. 40 people signed in at the open house, several staying the entire 2.5 hours. It's estimated that 10 additional people declined to sign in, and I wanted to make sure that I handed in to somebody the original sign-in sheets. 22 people filled out the exit questionnaires. We pretty much begged people to fill these out, and this, I told them, just as I did with these, that their comments would be shared not just with the client team, but with the city in an official report, and that's what you are about to receive. Matter of fact, I'm happy that one of the neighbors, Tiffany Stark, is here today. She came to the information meeting last Thursday. She is a social worker, so she really understands what we are talking about here. And I'm happy that she's here today, and we'll continue to communicate with anybody who wanted this kind of follow-up, whether it was people who provided their phone numbers here, or people who filled this out and said, yes, indeed, they'd like a follow-up from a member of the team. So with that, if there's any question, I could talk about this outreach forever, but if you'd like any more information about what it is that my team did, otherwise we'll just hand out the summaries that were prepared.
And if you could just describe the summaries, and I think we should hand them out, just so
Okay.
that they know what they're receiving, and I also wanna make sure staff has copies, so that we can also have it in the plan commission's file for availability when you talk about it as well. So I think Sheila has one report and I have the other.
So the door-to-door is a 7-page report.
That's
So
the
it
one I have.
describes that I introduced myself, clearly stated I'm hired to provide information, answer questions, write down comments, and follow up with anyone who wants more information. I went through as much of my information binder as desired, including, by the way, where the site is compared to where people live. This was very important, that people understand where they are.
Thank you.
You know, which site are we talking about, that kind of thing. I told them about the June 13 open house, and informed them that if they'd like to keep this invitation, because this is me on the bottom, this is my name and phone number, and that I'm available to them anytime to discuss anything that they'd like about this. I led every conversation with the explanation that this is a new proposal, with application just submitted to the city of West Dallas on May 31st, with a public process to follow, including public hearings preceded by formal notification. I offered to show neighbors the actual application, including the narrative, site plans, renderings, landscape plans, floor plans, and all the application components. I told them that as a courtesy, I was visiting nearest neighbors as a first step, prior to this application formally being discussed at a public City of West Dallas meeting, and that I wanted their impressions to be based on accurate information this early in the process.
We'll take the extras.
I told them I respected their opinions, would share their comments with UHS team and in a document submitted to the City of West Dallas. Especially for longer visits, you can see how some of these, I mean, there's a lot to talk about for some of these neighbors. For longer visits and a longer note, I offered to read back what I had written for their approval. Visit times range from less than a minute to more than 45 minutes per neighbor. I urge neighbors to share my contact information with anyone else who would like a visit or a call. I gave everyone an invitation. Nearly everyone seemed to appreciate the door-to-door outreach. When no one answered, we used these. Chris Korjenik followed the same process, and by the way, these are just my cards. She's got her own pile, so it's essentially double this. And then closest properties were visited a second time. Altogether, we talked with 106 people. We left invitation in these door hanger bags at 241, totaling about 346 touches, if you will. And then double down by mailing the invitation to 108 business and property owners. Yep. Several of you were at the open house, and, you know, I just think there's a lot of energy in that room, and I think that people had their questions answered, and they enjoyed walking around, and meeting with us, so, essentially, the same materials were shared. I think a lot of people, I mean, I thought that more people than, let's say approximately 40 would come, but a lot of people said to me, oh, well, if this is the same thing, if this is the proposal, I get it, I'm fine with it. You know, I don't need to spend any more time. So, we feel like we've done an adequate job, at least initially, to reach out and let people know that we cared about their opinions. And we'll continue to be there for them and answer any questions and forward them to you if there's more to know as the public hearings proceed. We'll probably have a slightly more robust. Oh, by the way, I never I told people that their comments would be random, so that's why you see this lengthy, essentially 6 pages of comments, because people wanna know that their comments are not gonna be shared and attached to their names. But they did like to know that their full comment would be listed here, and I fully believe that anybody who was spoken to would be able to find their exact comments in this bulleted list. Same thing with these.
What's her name again?
Would you like to describe your building, what you're gonna be building on this site?
Sure, I'm happy to do that. I'm gonna start, well, we talked about the floor plan a minute ago. I'm gonna actually focus more on the landscape plan, because it does have the site plan overlaid on it. But again, we're 68th Street here, and Mitchell on this side. And so the front entrance and the main location is right in this hard corner, and that's what you're seeing in this visual right here on the 68th and Mitchell corner. One thing to talk about the design too is city staff, we had the opportunity to present a very preliminary schematic design, and they gave us some very good feedback. And so the building actually has already evolved before we even made our submission. And so from our experience, that creates a better end product, and certainly something where it's not like in the public meeting we're trying to work it out with staff. We're waiting for our final formal comments at this point, but the building that you're seeing in these renderings actually is different than what we originally proposed. So we're very excited to already have had that feedback and incorporated it, and I think the neighbors and the reaction that maybe they saw reflected that, because this visual kind of shows how we are tucked into the neighborhood. We have the bars and the houses and the duplexes right across the street. We have other redevelopment opportunities here, some other good things going on in this area, so we're definitely going to integrate right into the neighborhood.
Brian, I have a question on that
Sure.
picture there. The fencing that is there, describe that fencing for us. Tell us how it's not going to be topped with razor wire, please. And yeah, tell us about the fencing.
Yes, and it's hard to see on this, but if anyone is familiar with the Rogers Memorial Behavioral Hospital at 113th and Lincoln, it's going to be very similar fencing to that on the perimeter. We have a black iron fence that'll have a curved top to it, and it'll be tall enough, but it won't have barbed wire, it won't be an electric fence or anything that's really not inappropriate for this kind of setting. So you see that as the perimeter, but we also at various locations have some more screen walls, which are consistent with the building design, and those also divide the activity yard there. So we're not creating really a fortress on the perimeter of all those yards. We have the see-through fence, but we do integrate in some privacy walls, and on this one you can see the top of it. I don't know if we actually created a board for that side of the site, but kind of similar to what's hiding our dumpster and our compactor and things that we do want to have a visual screen there. So the same treatment is going on for this side. There's a small activity yard there. So it's a combination of fencing, and we really like that end result. Again, that's something that city staff gave us some feedback on, and so again, the takeaway is we don't have barbed wire, and it will be able to see through, but then with landscaping in front to really create that sense of privacy for the patients, but also for the community, that they don't necessarily have to see in or feel like they're seeing it.
Thank you.
Any other questions on that? I think just to really go back to the overall site orientation, and maybe I will, the landscaping does kind of mute some of that out. This does show where the parking fields are a little bit better. So back in that corner is where we envision a lot of the employee parking will be. We'll have a nice parking field in that location. We have front side parking along 68th Street. That'll be primarily for visitors. The outpatient entrance, as mentioned earlier, is right here. Some employees will be able to then park there. We also have made an offer to the parking lot across the street. The city does not own that parcel, but we recognize it's always been kind of in tandem with this project site. So we do have an offer pending, and we'd like to then be able to clean that up and landscape it and bring that into some additional parking for our site. As mentioned earlier, there are the activity yards that come off of each one of the wings. We have kind of our back of house area on the far south, and again, that's where that screen wall will be to give the visual blockage. We do have an internal courtyard, so that's not so much seen from the outside, but that's gonna be nice to have a little, some additional windows and areas to go outside. And then the final two elements are access points. You'll see here we do have one where if a patient does need to come in by ambulance, it's not a lights and sirens situation, but they'll be able to come in off of Mitchell Street and really behind the screen wall area, it's called a sally port, they'd be able to have the patient unload and go into the facility there. And we also have one on this side of the facility so that, I don't see the ambulance drawn in over here, but it's right in this area. The same situation can occur, kind of behind the privacy screen wall, the patient can be unloaded safely and securely. The landscaping, we certainly put all trees and bushes and everything there. We do have stormwater and infiltration area here in the back. And I think I'll leave most of those details for the plan commission process. I think back to these. This one is just looking back then to the north from the 68th Street side to kind of give you a perspective of the building and its massing as compared to the existing buildings in the background, and how that landscaping treatment will work along the street edge. Finally, going backwards in time, we have some renderings of what was at the site. I know the Community Development Authority is well aware of that. The city has owned it and done a good job cleaning it up. We've done our own environmental testing and reviews of all of that, and so we are confident that as our plans are approved with the city, then when we know where the exact building location will be and we submit to the state DNR, that the final permitting for environmental will be granted as well. But so we're very proud of the opportunity, knowing what the site has been, an important industry for the city in the past, but now this opportunity to turn what the site, when Patrick had the grass picture there, what the empty site is today, and what we'd like to put right here, starting late this year and building for a hospital open in 2021.
Thank you. A couple of other questions, and we could ask them some other questions if you like. West Dallas is a very safe community. We want to make sure we continue to be a safe community. How does this facility participate in that process of being a safe facility for the residents and for the community?
In a minute, I'll defer to Sheila on that. We did already take the opportunity to meet with the police chief and members of his staff to really start talking about how our operations will fit into with the facility. UHS has a good track record of working with police departments and being cooperative in that relationship, but I'll defer to Sheila on any other specifics you'd like to share.
Sure. I'd like to say, I think oftentimes communities' concern as it relates to safety has something to do, at least in my experience in talking with people, with thoughts around discharge planning, and are patients going to be released onto the front lawn, and are they going to be wandering around the community and that kind of thing. And we have a very thorough discharge planning process. Patients receive a warm handoff to a location. They are not released in a neighborhood. Discharge planning for us truly does start at admission, and we're working on where is this patient going to live, who are their support systems, where would our aftercare be, and so that's not a concern. It's not something that we see patients kind of wandering around the facility, wandering around a community, or wandering around a neighborhood. I think to Brian's point, we do work hand in hand, and every facility I've operated and all of the UHS facilities, we work hand in hand with the police departments. We work a lot on milieu management. We're not in the habit of calling the police or outside agencies to manage our patients. We truly are clinical experts and working with them and keeping both our patients and our staff safe.
On that same subject, if I may, early on, going back many months when there were preliminary discussions about this potential, there was talk about the fact that patients would be driven to the facility and discharged patients would be driven to some defined location. Therefore, they wouldn't be dumped in the community. what kind of staffing do you have to accommodate the type of activity and turnover you're gonna have at this facility?
For transportation or for staffing in general? I want to make sure I understand the
For
question.
transportation and discharging, and so people are not out in the community.
Sure, great question. So, yeah, our facilities handle transportation differently, and I think it really depends on the community and the resources available. Oftentimes, our facilities will own vans and provide our own van transport. So we do what we call a warm handoff. So when a patient is discharged, we take them to where they're going. If they don't have a family member to come pick them up, and make sure that they have someone that they are handed off to, that they have a connection point. And so, like I said, some of our facilities do that through providing our own van transport services.
And will you have transport services for this facility?
I don't know that we have that level of detail worked out quite yet. I would have to defer to Diane, who's our primary operator, but if that, that is something that we typically do at our facilities.
And I'll share with Sheila, Diane was able to join us for the open house last week, and as Sheila just deferred to Diane, she'll be responsible for this facility. I know that Diane talked to a number of people about how we won't just let someone walk outside or say, good luck, your treatment is over. So to that point, there may be vans that we have and operate, but it begins with an expectation that someone may have a family member, a friend, a private mode of transportation, and if not, then we may have the facility be able to provide that transportation. On the receiving end, Sheila, correct me if I'm wrong, people can come in any number of ways, from the family member or friend. They may take the bus coming to us, just that's maybe a scheduled appointment, they know that they're coming, but there also could be the scenario where the ambulance brings them, generally not lights and sirens, it's not an
Non-emergency
emergency
transport.
basis, but they may be coming from another facility, and that's how they would enter through that mode of transportation. So most importantly, we're not just sending them out into the neighborhood, and that was a very important question a number of the neighbors did ask us as well.
John, could I ask another question?
Go ahead.
In today's Southwest Now, there was an article freely quoting Supervisor John Washam regarding that this facility is out of character for this location that should be at the county grounds. Have you heard from the supervisor? Has this been worked into the consideration? Is there any significance regarding his comments?
John has, Supervisor Washington has not talked to us. I know that UHS has reached out and talked with him. I know he'd prefer to see it on the county grounds, although several of the hospitals on the county grounds are vying for the site that they're gonna be vacating to build a multiple-story facility. And UHS's operational desire was for a single-story building to be able to supervise, to maintain security and supervision and manage that process, which is why they wanted that single story. This is obviously Ed's conflict neighborhood with old industrial and residential and commercial. So it's receptive to other uses than just residential across the street. What we were trying to achieve here was a building that looked like an office building that could be part of the broader redevelopment that we're trying to do in the neighborhood, to make that more compatible with the residential character of the neighborhood and the commercial industrial character of the neighborhood, integrated in with the new development that we'll be talking about later this evening on the 68th and Mitchell site, some of those facilities, so that we could, so we think it could certainly integrate. The bigger issue is what is being performed in there, which is the mental health facility. And that certainly makes people concerned and edgy. And I think that's why we're talking with UHS about their security procedures as to how we make sure that we don't get what they call elopement, like schools do or anybody does, that the people leave. And this is something we don't want to be able to see that. And I think when we talked about what their security measures were with the swiping of the key card to exit the facility, in addition to a 4 code punch in, this is getting a really good, high secure facility, and that's what we wanted for the safety of the neighborhood and for the residents themselves. So we were very conscious about that issue.
if I may just add to that, first on the design piece, to maybe go back to this and the evolution or the changes to the project. The architects, in surveying the neighborhood and trying to bring some design elements out, you'll see the gabled roof lines that we have in a number, and this one, the gymnasium is more of a slanted roof, but really trying to pick up on the peaks that are in existing architecture throughout the neighborhood as it is. And as well as the natural materials, we have a good amount of brick on this. Staff was very clear about the expectations of what types of building materials would be appropriate for a $30-some million facility and in this location. So that's one of the things on a design approach, we're trying to make sure that it's a good fit and address questions and comments like what Supervisor Wyshawn had. We also, as John mentioned, had the opportunity to sit down with the supervisor last week and make sure he had a full introduction to what UHS is all about. And I will just conclude by pointing out something we emphasized a few minutes ago, which is this isn't just a county facility. That'll be a portion of our patients. The referrals will come from county doctors and through the county system, but we will take referrals from Wheaton Franciscan, from Aurora, from Freighter, from all the other medical providers, private physicians out there. And so in that context, the county grounds area isn't a good location for what we envision as our new independent and private facility will be. And UHS has, as many of my clients do when they come to a new market, they've done a market study, they've looked at what the need is and identified that this really would be a good location to serve a need that is there, as well as fill their own needs with employment. The density of this neighborhood and where employees can come to easily access a new job at this location makes it a very attractive site for us. So that's part of what we explained to Supervisor Wyshawn of why 68th and Mitchell, why we're excited about the dynamics of what's going on with the new residential housing, the food and restaurants and other opportunities that are in the neighborhood existing and coming. So we're very much excited to bring a 24-hour presence and 250 some jobs to a neighborhood and not just be maybe another apartment building or another restaurant that people just visit for a few minutes.
Are you willing to characterize the supervisor's reaction to your discussion?
I wouldn't want to characterize that because I will let him speak for himself. I know he issued the press release and he was very clear in what he believed, but I believe that there are a lot of other issues with the county and how behavioral health is handled at the county level. I think he appreciated the opportunity to hear from us directly and hear from us as far as why this particular site. But we certainly let him have his opinion, and I don't know if it's changed or not, but we certainly want to make sure as it goes through the West Dallas process that we make sure we answer all the questions the CDA, the Plan Commission, and the elected officials have.
Thank you.
I think one comment I just want to make about the architectural character of the building. The first proposal was, as any proposals are, they're very bland, and I gotta give our planning colleagues a great deal of credit, and UHS's for their willingness to take a lot more bigger leap into architectural adventure. And so these buildings here, this building here looks like a lot of different components that really integrate well with the whole neighborhood and give the building a great presence, a sense of arrival to this neighborhood that I think as a very long-term design criteria that looks good for a very long period of time.
Excuse me. Alderman Groth has a question.
Yeah, if we can just jump back to the security thing, and kind of nobody answered it at the open house. How do you classify your security people? Security guards, security monitors, like there's two people fighting and the security monitor comes over and says, yep, there's a fight, let's call West Dallas Police Department. How do you classify your security people?
So
Do
we,
you want to take?
sure, would you like, or
I'll let you. I'll
okay,
defer to you.
okay, so typically at our facilities, we don't have security guards or identified security officers on site. We really handle, situations of escalation or of aggression from a very clinical approach. So we focus a lot on milieu management. We have code teams. We call them code teams. So if there is a code that is called for a patient who is escalating or becoming very agitated or aggressive, we have a code team that is trained to respond. We default to verbal de-escalation. So our staff is highly trained. Every staff that's clinical works on units at our facilities are very highly trained in how to de-escalate patients, because putting our hands on a patient, intervening in that more typical security type way is something that we shy away from doing. You know, our goal is to de-escalate verbally, to calm a patient down, and to not have to put our hands on a patient. If we do have to put our hands on a patient, there are very specific protocols for that, very specific training that our staff go through about how to do that safely, to keep the staff safe and also the patient safe. So to answer your question, we typically, we don't have security officers or guards. We have a very different approach, I think, to working with tension, escalating situations and the like.
Sheila, I'm gonna ask you in a minute about kind of hardware and the security systems and the door keys and everything, but one thing I wanted to add in the fact that I was able to sit in on the meeting with the police department, Sheila spoke very accurately about what we presented to the police department, and that is that our staff is trained and our staff is committed to handling the patients within our facility, that we're not just gonna call the police department and say we have a problem with this patient. Because the police chief was very clear, his staff doesn't necessarily have the behavioral health training that our staff does. So first and foremost, we take care of what we need to within our four walls. Obviously, if there's a life safety or if there's a reason to call the fire department a fire, that when there are emergencies, of course, we will reach out when appropriate. But when it's a patient who's escalating or a patient that's having an issue and it's part of treatment, that's when our staff and their training kicks in, and we would not be in a position to be making the police department overtax its resources. Likewise, if the police department needs to come to our facility to visit with a patient, we have protocols in place to make sure that works for everyone. It can be disruptive for patients and other treatments, but there are ways that we can, wherever the floor plan disappeared to, we can bring a patient into maybe a private room down in this area versus having, say, a police officer walking through the patient wings. And so we just need to work through those protocols, which is customary once we are up and running, as far as how the police department can access the facility and when we can make those patients available. With the floor plan back up, Sheila, can you talk a little bit about access as far as, say, a visitor coming and staff and badges, and I seem to recall there's a keypad so that if maybe a patient grabs a staff badge, they can't necessarily exit the facility because there's a two-step process. And I actually had the opportunity to visit a facility in the Nashville area in the last couple of months on a trip, and I was able to witness kind of presenting my ID. I was simply a visitor, but I experienced some of that. But if you could just talk through staff security, access to the facility by visitors and patients, how they can come and go.
Sure, I think you articulated quite nicely the double check system as it relates to keypads and badges. There are a number of ways to do that. I think, you know, the facility layout is designed itself to prevent elopements, as someone had brought up and mentioned, with two-door locking systems. So you have to badge in through one door, it closes, it locks, then you have to badge out through the second door, closes and locks. So there's the facility itself is designed for safety in that way, to include when you get past the lobby. So visitors will enter a lobby just like you would any other, you know, medical office building or, you know, hospital lobby. They will be asked to sign in by the receptionist, show ID to the receptionist. We have them sign off on a HIPAA compliance form to make sure that the privacy of our patients is being respected. Visitors are asked then, and again, this is all about security, to leave their belongings in a locked, in a locker, a personal locker, so that we don't have any kind of contraband brought onto the units that patients might get a hold of that they might use to hurt themselves or someone else. Things that you and I might not think about, like a pen in your pocket, can be a safety issue on an inpatient psychiatric unit. And so we go through great lengths to make sure that all of those items are emptied and left behind. And then we bring visitors onto the unit. Visitors are typically visit with their loved ones in public areas so that we can keep an eye on them. On our units, we'll typically have a number of public spaces that are non-bedroom spaces, such as, you know, an activity room and a noisy activity room, a day room, a group room. So there's a number of spaces where patients and their families can go and visit and have some privacy while also being safe and under the watchful eye of our staff. I'll mention too, not just from a facility perspective, but from a process perspective. You know, I mentioned we keep our patients safe by focusing on clinical practice and by focusing on honing our expertise in de-escalation and milieu management, but we also have observation systems in place. So all of our patients are observed on a 15-minute basis. Eyes are put on a patient to see where they are, to make sure that they are safe. sometimes more often than that, but that's a standard minimum. I see social work in the back nodding yes. This is a standard minimum that we do and we conduct, and not as a supplementary system, but as an additive. We also have cameras, very sophisticated camera systems that are placed throughout the facility to, again, assist us in monitoring the patients and all the activity with or without visitors on the units.
Thank you. Does that answer the question?
Somewhat, it's like, why have security then if you have a staff to do it?
And again, we don't necessarily have security guards, but the staff is trained first and foremost for the patient care, and then we have the protocols in place to make sure it runs the way it should.
Can I ask a question?
Go ahead, ma'am.
I just wanna, do you guys have, restraints if need be, like for last result, if someone isn't able to get calmed down by, the de-escalation, and do you have a restraint room?
We do. We have our restraint protocol. Many of our facilities are restraint-free, or seclusion-free. But again, for safety, our staff will be trained in that, and it is available as a last resort.
Could I ask a question?
Go ahead, Alderman Ranky.
I also have a problem or a concern with the security in your facility. Basically, the people that you have as patients, are they hardcore mental health? Do they have hardcore mental issues? Are they allowed basically to walk in? Are you allowing walk-ins? Are you allowing indigent people to come in, escorted, say, by a police person? I guess I'm looking for more information as to the kind of patients that you will be helping. If you could tell me a little bit about that. Are these referral patients? Are they gonna be walk-ins? Are they going to be escorted by police because they have issues?
Sure. Great question. So we serve a variety of patients. We are not based, funding specific. We accept patients in need of crisis services, whether or not they have the ability to pay. As it relates to their specific mental health issues you had referenced, we see a wide range. I think, most mental health patients are people like you and I, or our neighbors, or our family or friends that are going through a crisis or have had, something happen in their life and they're needing some extra support at the time. That's the vast majority of people that we see. Some of them do have serious mental illness that is pervasive and that they struggle with on and off through their life. That said, in all of those categories, the vast majority of the patients are not violent. They're not aggressive. They're not getting agitated and escalating and requiring security. They're just not. Most are there because they're depressed, they're having anxiety disorders, they're having post-traumatic stress based on some sort of very unfortunate event that has been inflicted on them in their lives. So, most of the patients that we treat, again, a wide variety of clinical presentation, wide variety of ages, of payor status, and they also come to us in a wide variety of ways. Adolescent program, for example, probably most of the referrals will come from schools. That's what we typically see. So a school counselor will intervene when they see a kid that's really in distress. We'll get the parents involved and recommend that they bring them in for an assessment so that we can assist them with services they may need. Adults come in a wide variety of ways. I would say the vast majority of our admissions for adults come through hospital transports. So a patient will end up in crisis and typically in an emergency room. They'll be evaluated and cleared medically, and then it's determined what they really need is some mental health support and services. And so they're brought over, as Brian mentioned, in a non-emergency transport without the sirens and that kind of thing. So I would say the vast majority of the adults come through either transports from a medical facility or perhaps a referral from their therapist or from their community physician. Sometimes we do have walk-ins to the facility, and we're fully equipped to assess anyone who walks in 24 hours a day, 7 days a week. We want to be there to triage, to provide support, and to make that level of care determination and connect people to services. We do get referrals from law enforcement. It is actually an important part of our work to help police officers identify when they're out in the community, people that really are not in need of going to a jail, but really and truly are in need of mental health services, and to bring them directly to us and not put them through that legal system. So we do work with the police officers in identifying those patients, and sometimes they do bring them directly to our facilities. And then lastly, I would say for the elder population, a large number of patients that we receive are from nursing home referrals. So patients that cannot be safely maintained at that time for whatever reason, their medication's off or what have you, the nursing home staff can't take care of them. They'll bring them to us, we will get them stabilized on medication, and then we will get them either back to that nursing home, hopefully, or if they're not welcome back there, we'll get them placed somewhere else, or maybe that wasn't the best situation for them. But elder care referrals a lot from community physicians as well, oftentimes brought by their families. Does that answer your question? You asked several, and I was trying to hit them all in my response.
And I was going to emphasize a few things, and I'm glad you touched on the walk-in potential, because we want to be a facility that's there for people if they are in a moment of need, but we are not just, that's not how we market ourselves as a walk-in facility. And certainly if there are people loitering around on the outside, to our staff, we would look into that and really try and find out, well, who's out there, what's going on. So it's not the main part of the business, but of course we are there for someone if they do walk into the facility and need some services. But Sheila's been talking about, and the word that's important is referral. Almost all of our patients come to us through a referral, whether it's from a physician, a therapist, through these other agencies. Someone is sending a patient to us. And then back to the earlier question, they may come to us in a variety of ways. They may come to us through a private vehicle or from a medical facility transport in a medical.
I guess I'm thinking possibly of the county hospital, where the police are usually called when there's a problem with a person
Sure.
that is having difficulties, and they're being shipped to the Milwaukee County Hospital.
Right.
I'm thinking of our police force basically doing overtime with this kind of scenario. And we don't want to be utilizing our police force.
No, we agree, we agree, that's not the best use of your resources. And I think we have provided to the city some referrals of other police departments in areas where we have facilities that we're really able to speak to, you know, how we work well together. And if anything, I will tell you that most police departments see us as nothing but a benefit and resource to them. We do a lot of training and education. We do crisis intervention training for the police force to help them know how to best manage patients when they encounter them in the community. So we want to be a resource to the police officer, not pull your resources to our facility.
The other point to clarify on that, if I may,
Yes.
the importance of everyone's experience with what Milwaukee County provides. And right now, Milwaukee County provides everything, the emergency psychiatric services and the emergency department there, as well as the inpatient and the outpatient services that we'll be doing. All we are doing and all we'll be doing in this facility is the inpatient and the outpatient. We will not be doing that emergency department psychiatric service that Milwaukee County still will be doing. And so I think there's
It's an important distinction.
It is an important distinction, and Supervisor Weisschott, I think, back to that conversation, that was one of the things he was really asking us about, as far as, you know, how the police and the sheriffs have to be involved with that level of care, and that, those patients need that important care, but that still is gonna be a Milwaukee County service. We won't have that type of police presence round the clock that some people recognize happens at the county, and that's by necessity at the county. But our program is gonna be different than that. We're just the piece that we've talked about this evening, as far as the inpatient and the 7 to 12 patient day stays, and not that psychiatric emergency department role.
I've been made aware of Waukesha Mental Health Facility. They basically are located near a jail. And from what I understand, the sheriff is at this facility all the time. So my concern is that we have security, enough
Sure.
security. I realize you have a different program with your staff that are trained. I live near a school where they have this kind of operation, but there are many times when they call in the police because they need help with the security, with these students that are in this program. So do all of your facilities, you said you have several facilities all over, do they have, security staff, or is it just your staff that
It's
is
our staff. It's
maintaining
our staff.
order?
And I think another maybe important delineation too is I want to be clear, we are not treating a forensic population. And I think that is really important. You know, the vast majority of our patients are going to be voluntarily admitted, and do not have, you know, current criminal activity that has, you know, resulted in their placement in a treatment facility.
Right, so when you
Excuse
might
me.
see on the news, someone's going through that evaluation as part of the criminal justice process, that's not what we'll be doing at this
Yeah.
facility.
We have a question from John here.
Thank you. You had indicated you provided some information relative to your partnerships with police departments in, for other locations. Do you have any call volume information? How many times the police are out to your sites? Any sort of statistics that could help us evaluate what kind of a security threat this really might be to the neighborhood?
Not to my knowledge. I will tell you, we call so infrequently. It's truly not something that we track. I
This has
think.
been good anecdotal information. Do we have any pure statistics that we can
We,
evaluate?
the chief did call around to several other similar facilities, and then sent us a memo relative to his findings. We'll send that out to all the commissioners in the council.
Thank you.
I have one question.
Go ahead,
Are
ma'am.
you gonna have, detox at your facility?
Can you say, I couldn't hear, can you say it
Yeah,
again?
detox.
Detox? Yes, we will have detox. That's a standard part. And as a social worker, excuse me, I'm sure you appreciate about 90% of mental health patients have co-occurring substance use issues, so we find that as just a necessity.
Very good.
Mr. Chair?
Alderman
Why?
Weigel. I'm sorry.
Detox but no rehab, no addiction treatment? Detox, as I understand, the immediate short-term illness you can do with.
Right, that's right. So that.
You're not doing addiction.
No, that whole rehab residential treatment, we do have that as a service option throughout the country and other facilities. That's not our intention for this facility.
And then a couple other big picture questions. This is your first one in Wisconsin, Southeast?
It is, it's our
Are
first in the
you
state.
Pitching other locations in southeastern Wisconsin currently? Are you seeing this as the first of multiple locations?
That hasn't been part of our discussion, to be honest with you. We're
You
really
just can't tell us.
focused. No, it hasn't, but it's not in discussion to my knowledge. I mean, we're really just focused on, you know, getting this set up and getting it set up right. And then certainly if there are work in the state, there were other identified needs, I'm sure we would be open to considering it.
And I was at that neighborhood meeting, and it's that emergency treatment, I think, that it's got everybody very concerned.
I see.
So you have a contract with the county, and you're building this for the current contract. And if the county can't find somebody else that's suitable to provide those emergency services for them, is this facility built in such a way that it could, in a different contract? Would this physical building be suitable to handle those emergency psychiatric services?
We did not design it with the intention of future expansion or, you know, to be constructed in a way that would allow for that in the future.
For this use. I'm just trying to
That's
get
correct.
some sort of satisfaction.
Sure.
Whether we do it through the physical structure of the building, the infrastructure, or through the special use permit, so that this never turns into something that the neighborhood really does not want.
Understood.
If I could add to that, as part of the special use process, we will have that in our special use to prohibit that, so that if the corporate policy changes, the city's not changing. And so it would be, so we can make sure that what they're promising us is going to continue well, it will just continue.
Right, and I'll just add that my understanding through UHS is that the way Milwaukee County provides those emergency services is unique throughout the country. And where I'm going with that is probably the new partner in town, being UHS, wouldn't be the right person the county would look to ultimately resolve that. That I think the county still needs to work through what they're going to do with that piece of the services. And there are a lot of other good stakeholders and other providers that hopefully can be in a partnership with the county. But we're very much aware, as John just said, that our special use permit would not allow for that. And so it's really not something that we've focused on in the facility. We're pretty tight on the site as it is anyway.
And the general belief is that emergency service probably really should be provided somewhere on what we'll call the county ground, right?
Potentially, or as I've learned through UHS, really most of the local hospitals provide that immediate emergency service and then a referral to a facility. Here in Milwaukee County, it's all going to the county grounds.
So you think it's gonna be more dispersed?
I don't know,
That's how
that's,
it's handled.
that's that community discussion
That's
that
the
they
big
have to work through.
complicated
That's the
issue.
complication right now.
I know
Right.
we take some involuntary clients if the county doesn't have beds, but we're a unique facility. But a lot of other places won't take those patients. So
What's
it's
your
a big
facility?
issue. I work at the VA hospital.
Oh, I've heard of it.
Yep. Very unique
Yeah,
facility.
in my discussions with Milwaukee County Health, they're talking about moving the crisis intervention service off the campus and somewhere,
East,
not West Dallas, some other location in Milwaukee County.
where they're looking to get central.
Yes,
Different discussion.
they're trying to get it more central in Milwaukee.
Any other questions? Any other questions?
Do police, I know the answer is why I asked it. Do policemen ever enter inside the facility? Is there, I know that our police department, some services, they want the police department to take their guns off to come into the facility. Our police chief does not want that, and we've said that very soon, that that will not happen. The police will always be armed, and I think that's, so they'll come inside the building in the visitor area, but they don't come in to restrain people or to do
Correct.
anything like that for.
Correct, that's why I
If they
talked
had
a little
to
bit.
investigate and talk to somebody, they would bring them out to sit down and talk with them, and
Right, we'll work through that protocol, we committed to the police chief to doing that, but something like a meeting room in this area, not in the patient wing, but so we understand the police officer may wanna keep all of his or her equipment and not check it in, so we would make that accommodation in a way that works for us, the patient, and the police officer.
At the neighborhood meeting, there was a gentleman walking around handing out some literature about something he had published that was not very flattering of UHS. Milwaukee County did an excessive review process of UHS. Would you just describe what the county did to vet your company?
Sure, it was very extensive. I think our work together probably lasted a little over 2 years. A number of written responses provided by us as it relates to policies, procedures, practices. A lot of data was collected around our quality, clinical product, our outcomes were a particular focus. How do we know we are successful in treating our patients? What do our patients actually say about us? What do our patient families say about us? What do our employees say about us? In a very factual and data-driven way, which is very different than some of the less than flattering commentary that you see out there about us. I will say that the diligence process included conversations with a number of senior executive leaders within our company, asking, challenging questions around investigations and around SEIU and some of the things that you're referencing. I will say that the due diligence process also included a number of site visits to UHS facilities, very thorough site visits, where multiple hours were spent at the facilities, walking through programs, speaking with staff, talking with some of our patients and doing that kind of thing. I will say that as a participant in that process, that is the most thorough due diligence process I think that we have been through. But I think the county, the makeup of the committee that was charged with identifying and proposing a provider to work with BHD was very diverse and had a lot of different interests and perspectives, which was very interesting and welcome. You had operators, you had attorneys, you had community stakeholders, you had providers, you had activists, you had former recipients of care that all participated in the thorough vetting of our company.
I'll just add, I referenced my own site visit, and Sheila just mentioned Milwaukee County did site visits. We're going through this whole public process for about a month. It's the summer vacation season. Your travels may take you certain places, to the elected officials or the members or even staff. We can certainly arrange if someone's gonna be in town or we have one of the facilities and you'd like to have a site visit, channel that through staff and we'll see if we can accommodate that. Because I think that was very helpful for me to really experience to be honest, I'll tell you, it was very quiet. It was very well organized, and the safety and security was taken seriously. Those were my just off the cuff impressions. It was just very quiet. It was a peaceful setting, and I could see why the emphasis was on the patient. So again, if anyone happens to be traveling, we have 37 states in our footprint right now, and so we can certainly accommodate a site visit if that's of importance to someone.
Could I just add that UHS has volunteered to make the facility available for an open house for neighbors before patients arrive, so that neighbors can be in the facility and just kind of take the mystery out of what it's like in there. So that's something that a lot of neighbors are looking forward to doing.
There was also, I read something about some concerns about billing errors with UHS. Could you respond to that?
The billing errors, are you
For
speaking
the government, to the government?
the DOJ?
Yeah.
Yep. Do you want me to speak to that?
Please.
Okay. So, yeah, well, I would first and foremost say that we have consistently and vehemently denied any fraudulent billing charges or practices as a company. I will also say that the investigation by the DOJ has been open for 6 years, and they have not had one finding against UHS. So it remains open. We are ready for it to close. There have been no findings, but they have not closed it yet.
Mr. Steve, what do you want to do? Are you done?
We could just adjourn the session.
Okay.
Once everybody's asked their questions, we can go on to the next item, and we'll
All right.
take this up in closed session
All right.
at the conclusion of the meeting.
All right. If there's no more questions,
Just a second.
we'll, go ahead,
Patrick,
Patrick.
Again, if you were gonna look at the facility, I know UHS has provided this information of the economic impact to the community. The facility would have a sizable payroll, on an annual basis, and this is information that was shared throughout the neighborhood, I believe, or to the aldermen, on the impact. And then, of course, after tonight, it's just an introduction to the CDA, and the next steps, again, our plan commission on June 26th, the public hearing for the sale of land on July 9th, and then the council would approve a development agreement on July 6th.
Consider a development agreement.
Oh,
And,
is
per-
it-
and,
Cart horse.
and special use.
Thank you.
Mr. Chair,
Go ahead, Alderman
how
Weigel.
many of those are public hearings?
There'll be two public
CDA is a
hearings.
public hearing and the plan commission, or the,
There'll be a public hearing next week before the CD, or 2 weeks before the CDA.
and then the
And a public hearing before the common council on July 16th. And then the council will dispose of that matter at their leisure.
Do we know what time the meeting will be on the 9th for the public hearing?
The community development authority is 6 o'clock, common council would be 7 o'clock.
On the 9th?
On the
the
9th,
9th is 6.
yes, on the 9th.
Do we have any more questions? If not, I'd like to thank these two ladies and the gentleman for the presentation, and then we'll continue with our regular schedule here. Thank you very much.
Thanks for having us.
Since it'll be closed session, you don't need us
Oh,
to stay.
You want them to stay for closed session? or
Do you need us to stay? We can, and we'll leave our boards if that's
Yeah,
okay.
we'll
Yeah,
take care of,
we'll take care of
the
that.
boards.
Thank you, everyone, for your time, and if there are any other questions, let us know.
Thank you. Yeah, thanks, Brian.
I do. Quite a lot.
Thank
I
you
won't
very
forget my
much.
jacket. I was, you know.
Thank you for having us.
Pleasure seeing you again.
You as well,
Put me on the
thank you.
spotlight.
Mr. Chairman, in the interest of the audience, if we could move up an agenda item to item number 5, which is the tax increment
17.
5
On the agenda, yes.
on the agenda,
Okay.
which is the hotel. Discussion relative to
Right,
TIF
I'm going.
district.
Okay, we're going to go to item number 5, discussion relative to proposal certain tax instrument district number 17, Lincoln Avenue West Corridor, 10201 West Lincoln Avenue, West Dallas, Wisconsin. Mr. Stiebel, you have the floor.
Thank you. Patrick, would you like, we have a proposal for a Holiday Inn Express. They have said to the city that they need some financial assistance in the form of a tax increment district. And so we will evaluate that process. We won't be coming to any conclusions tonight. We haven't completed our evaluation, but at least we'll give you a background as to where we are, what we're doing. Patrick?
This is an introduction of the project. This is the redevelopment of the Weir Steel office building on 102nd and Lincoln. You might recall seeing this office building has a unique presence. It's very limited in terms of occupancy, and the property is for sale, and they've reached an agreement to purchase this property, tear that building down, and construct a 4-story Holiday Inn Express. Currently, that property is assessed around $1 million. In terms of that, there is a new assessment that has gone out, and that the owner will have to appeal that value based on the numbers. But this is the new hotel. It's around a $16 million development. It's they are on a quick agenda or quick process here. They have reached, they've gone to Planning Commission, received approval. They are asking us for TIF assistance to help facilitate the development. They would like to have this facility built by next July. And the reason why is because there's a certain convention coming to town, and there's supposed to be a lot of people coming to that convention. So this is the site plan of 102nd and Lincoln. Obviously, this would definitely create some increment necessary, of course, with the TIF, with the assessed value of $1 million and new construction. When we looked at this, the approval process for a TIF, tonight is the introduction. The Joint Review Board would meet on June 28th. The public hearing for the creation of the TIF would be July 9th on the boundary and the TIF plan. The Common Council would then take up the approval of the TIF on August 6th, and then a follow-up Joint Review Board meeting would be August 7th. If you looked at the requests, they are requesting around $1.4 million to help do the development. It's a developer-funded TIF. That means the project would have to perform to be able to realize any of the increment that is realized on the project. So around 20 full-time jobs that would be created. So when we looked at the boundaries of the TIF, we looked at the general area along this corridor. Since this is the project site, we're looked at, is there opportunity to gain additional development in this area? And currently, there is a church for sale on around 106th in Lincoln. So when we looked at this broader area, we also noticed this building has gone through auction. It may have been purchased. I know there's some discussion if that has actually gone through, but this property would be in need of rehab potentially to attract a new office tenant. So with the church site being available for development, this building, the idea would be to create a rehab and conservation TIF district under the Wisconsin statutes, and here isolates the properties that would meet that statutory requirement. There are around 17 properties that were identified within the boundary of the TIF. This outlines all the borders of those parcels that would be included, and it does go up to, I can't make out what that is, around 107th and Lincoln. The TIF base value would be around $12 million. We looked at what the total base of that district would be, and we looked at this is the draft concept of feasibility of the TIF of a budget of around $2 million and how that TIF would perform. This creates a half-mile radius for economic development projects or help TIF funds to be used for rehabilitation of homes around the half-mile radius as well as administration of the TIF district. This TIF would perform quite well. You can see here it pays off in a few years once the project is developed. If we created this in 19, you can see here it pays off in around 2026.
2026? So
Agreed.
7 years?
Correct.
Oh, well, no problem. All right.
He didn't really mean that.
That's right. We're not considering, well, not making a decision
Now,
here.
we are working with Ehlers on, there's an item that was on this agenda to help prepare these numbers. We have a number of firms that are helping. We did a market review to see if, does this impact the construction of a Home 2 Suites on 70th Street, which we wouldn't want to have a detriment there. SB Freeman's reviewing the performa, is this performing to market? And then Concord's can help us review the construction numbers to make sure that they're in line.
items 7, 8, 9, and 10 are gonna be related to this when we get to them. And that is to hire some outside professionals to help us evaluate the proposal that Mr. Ford is gonna present to us. Typically, we use Ellers, the city's bond counsel, and we use SB Freeman as a financial consultant to talk about internal rates of return and cash on cash returns, and try to look at the development to make sure that we're not overly enriching anybody and that we're within the market sphere. This time, we're also gonna recommend that we hire a Concord, whose job is to estimate budgets and to look at the construction cost, to make sure that the proposed costs that we're assuming that are gonna cost are gonna be as real as we can get. And that helps us in the way that, usually, we have in our development agreements a cost sharing. If there's cost savings, we want to participate in the upside, and so we wanna lower that amount that would be exposed to cost sharing, so that we get all of it, theoretically. And so we're trying to squeeze this project from the top and the bottom as much as we can to make sure that if there is a need, if there is a gap, there's a true gap, and that we're only financing just enough to make this thing work. So eventually, it should come down to, this project needs $522,000.38 to make it cash flow. And that's the kind of specificity we want to get to. Or it may come in, we don't need any, and that's what we'd like to see, but we're willing to take a look at everything.
So we, this evening did invite the developer here, John Ford from Catalyst. Maybe if you would like to have him come up here and introduce his project or who his team is, based on his request, we thought it'd be helpful to have him here tonight.
Please come forward, sir. You can come right to the front or wherever you want to sit.
Hot seat.
Well, good evening, appreciate the opportunity. Thank you, Patrick. As Patrick said, my name is John Ford. I'm a partner with Catalyst Partners. We're excited about this opportunity. When we look at development, it's not just another project for us, it's about enhancing the community. And we looked at this site, obviously with a relationship, and went through a number of different uses. And one of our partners has done hotels pretty extensively throughout his career, throughout the southeast Wisconsin and other places, and really think it's an opportunity to not only to be a successful hotel, but to really impact the community as well. You've got obviously a 1970s built office building that is roughly 15 to 20% occupied today, achieving rents in the low single digits. As Patrick alluded to, the current assessed value of the site is just over $1 million. You know, what the plan for that building as it continues to kind of decay, so to speak, being the age that it is. What we would like to do is kind of put a whole fresh new look on this area of the community. And we're excited that staff has looked at how do we enhance not only potentially this site, but the church that's down the street. The office building, Patrick, you mentioned, that was up for auction last year. I talked to the auction company, they said a buyer was selected, but that fell through. Where that's at today, that building is 40% occupied, obviously struggling. So I think this whole area could benefit from this initial project, which we are excited to get in the ground, hopefully by September of this year, to not only be open for the convention next year, but obviously anytime you open up a hotel, typically the time frame is late spring to early summer, and after you get past that point, it starts to kind of not be the time to open up a hotel. From an impact, we estimate roughly, potentially, just from the hotel alone, if you look at an occupancy of about 70%, which is slightly under what we're performing. With an average person and what they typically would spend for an overnight stay, this could have an impact of around $10 million on an annual basis to the larger community in total. From a economic jobs impact, Patrick mentioned roughly 20 full-time positions operating the hotel. From a construction standpoint, there's approximately 100,000 construction hours, which is equates to about 45 full-time jobs for the construction of it alone. From a cost standpoint, we're at about 16.3 million, all-in total costs. The hard costs, as we've been meeting with some of the consultants, we were meeting with the Concord Group last Friday to answer any questions, and they're going through all the hard costs as we speak. My partners, Catalyst Construction, are currently under construction with the Fairfield in Milwaukee West, just south of Miller Park there. So we have real-time data as far as what that's costing, and that's obviously what we're basing all the hard construction cost numbers off of. So with that, if there's any questions, I'm happy to.
Do you have any questions, to this gentleman?
Anything else on the project?
No.
One other thing I'll mention, so this, I don't know if you have the site plan. So this is phase one. The hotel takes up, this site is 3.2 acres in total. So you'll notice the shaded blue area, kind of where the building sits today. This will remain, for now, a green space, but that would be phase two development. That's approximately a 1.1 acre site. So that could turn into, we've had some conversations with medical office type. We think it'd be a great medical office site. It can fit roughly 15 to 20,000 square foot building, which would equate to, somewhere in the neighborhood of $4 to $6 million additional project potentially in the future.
Thank you for sharing that.
Yeah. Thank you.
Thank you.
Any other questions or anything on this one? Thank you, John.
You wanna go to item 6 now? 6 is 7, 4? Okay. We go back to item 4?
Yes.
Okay, we're gonna go back to item 4. Discussion relative proposal for the development 6771 West National Avenue, 6751 West National Avenue, 6700 West National Avenue, tax key number 4540252-00, and 6700 West Mitchell, tax key number 4530564-002. Mr. Stevel.
Thank you, Mr. Chairman. The Community Development Authority owns that block on 68th and Mitchell that has what we all refer to, 6771 as the White Building, and then the Perfect Screw facility we've acquired. And we issued an RFP to get development proposals to construct on both of those sites. Many of you have seen, driven by the building, you see where some of the aluminum is taken off. And that was taken off to allow the state Historical Society to take a look at the building to see if they could determine if it was eligible for the National Register. If it is eligible for the National Register, it could provide historic tax credits to a developer between $2 and $4 million depending on the development. So it was very valuable. And it was determined that it very well would be eligible for the National Register. And that's when we went out and issued the RFP to try to drum up some more concepts of what competitors might want to offer to do with this site. And what we'd like to do is just review those, what we've got today, and then we'll talk more about them in closed session. And then we'll, in the next month or so, start picking who do you want to have as your developer. And Sean, if you'd like to go through this and explain what we've got to date.
Thank you, John. Like John had mentioned, we have put out the RFP and received the responses last Friday. We received sort of, would say 2.5 proposals because the site is sort of bifurcated into 2 areas. So there's the historic preservation aspect with the historic tax credits, which are very attractive to developers. And so there's a certain group of developers that were very interested in just preserving the White Building and just working on that project and making it a really interesting building and using those historic tax credits to their advantage. And then there's the second part of the project, which is just, we have the Perfect Screw site and then the vacant land around it. And, what are we gonna do with that? It sits obviously between, our farmer's market, the next phase of Mandel, and then whatever's gonna happen at the White Building at 6771. So we put out the RFP to try to sort of fill in that area. We did it with the hopes that developers that do historic work would partner with a developer that maybe just does traditional development work. And so we did get 2 proposals in that regard where two really high-end historic developers did partner with more traditional development entities. And so that's what we can show you here, but it's, yeah, the site's it's broken into 4 sites, currently totals 4.7 acres. The white building 6771 site, takes about 1.7 of that acreage. One of the first proposal we received was from a company called Baum Revision out of Chicago. They're currently working on a Garver feed mill in Madison, which they viewed as a very similar kind of project, and they have sort of modeled their proposal for this property after that. It would work well for them timing-wise, as they're just finishing up the Garver feed mill as we speak. And what they're doing there, and what they're essentially proposing here, is an event space, a large event space to attract people to this, what they view as what could be, a really interesting building to draw people from a tourism standpoint. They want to do weddings and parties, corporate functions, things like that. That they're finding there's a gap in the market in that area, and they think just to have people in the building, the public in and out, rather than perhaps a multifamily development where it would just be people live there, you drive by it, yeah, it's a nice building. This is people interacting in the building, going in. So they would break it up into event space. They want to do a food production aspect to it, so that could be anything from a brewery, coffee brewing. They have a kombucha place at the Garver feed mill where they actually make it.
Sean, what's kombucha or kombucha, whatever that word is you said?
Trendy tea that younger people drink.
Yeah.
That I would
Okay.
I've never tried.
Thank you.
There's a version with alcohol too.
What's that?
There's a version with alcohol.
Okay. So.
Available at your finer establishment.
Do you know one?
And so they're very excited about this. They had the company that did the windows at the Garver feed mill out to get real estimates on this. The numbers are real. They've dove in this pretty deep. They have partnered with Kabbalah Washaka, an architect a really high-end architect that they also worked at the Garver feed mill. So they're very much interested, and it works in their timeline. They've also partnered with the vacant portion of the site. They partnered with the Mandel Group to do multifamily on that portion. And so they're looking at doing about 90 units, 2 3-story buildings. And so that's sort of their plan for how to use, that was their response to the RFP. Just a few visuals. There's a mezzanine floor in there that they would use for dining space for events, and just when there aren't events, it would be sort of open for, they'll have smaller commercial tenants that do food production that would support the event space and obviously would act as almost a commissary to ship things out. And the other thing that we would be excited about is that we see a big need for, based on the types of businesses we see coming in, is a kitchen incubator. Would help start up restaurants and things like that, get their feet on the ground, a cheaper shared kitchen aspect that really fits nicely with the market that we have. The other thing is their commercial tenants, they're not pricing this at some ridiculous price where it's just gonna be vacant space. It's $9 a square foot. It falls in line with what our market actually is, which is maybe defer from some of the things we've seen in the past from developers. So like those aspects of it, this is just a potential view of, of the event space. Obviously it's just floor to ceiling windows, and that's the big attraction to it. Has the wood ceilings, and it's a
And the
pretty
grading.
interesting space.
The grates of the columns.
The steel columns and such. This is a view down, so this would be National Avenue event space. This would be sort of like a shared sort of bar / kitchen area, and then this is where you're showing some food production, and they show like a cafe sort of facing out towards actually where UHS would be towards Mitchell. And they would have sort of commercial tenants which support this on the sides. It's just a very similar setup that they have out in their site in Madison, the Garber Feed Mill. So you can kind of see that broken out on here as well, just with it boxed out. The second proposal received is from one of the probably more well-known historic preservation companies in the Milwaukee area, Jeffers, J. Jeffers and Company. They would convert this to 81 residential units. They're doing work all over the city of Milwaukee now. To have them respond to this is pretty exciting for West Allis to get this type of developer to respond to a site. So 81 really nice, pretty striking, units, and then they would fill that vacant space they're partnering with a group called Matter Development, who's does a lot of senior projects.
Is that you,
in the
Jerry?
area.
Yep, I didn't know I owned it.
And so they're doing, they would do
Matter?
a two-story senior living facility with would be 36 units of memory care and 36 of more traditional senior. And then we received a partial response. This is just for the open acreage, not for the historic portion of the site. For like the 3 acres adjacent to it. We've seen this come in front of the CDA before. It's the physical therapy group, 45,000 square foot facility. They're ready to build. They've done the market study in the area and are really searching the area and have been, communicating with us over the last, 6 months or so. They had shown us a 1-story option for another site, but are willing to go to 3 on this site, which makes it sort of fit into the area that's needed. Gets them down to a 3-acre need, and it fits from a scale perspective, would fit in nicely between what Mandel is doing and will do, and then and the obviously the 6771 building, which is basically 3+ story building from a height standpoint. So that's what we've received thus far. We can talk about more of the numbers and things in closed session, I would think.
All right, you're gonna go to item number 7, 8, and 9?
Excuse me, on number B,
You go, question, mister? Go ahead.
that's you, correct?
Yeah.
Number B?
No.
No? How about number D?
Which one's talking about?
What's D?
D is the new matters and previous matters.
No.
It's under perfect screw, matter development.
Oh,
Yeah, when I said that, I was joking. Wayne.
Yeah, he was just joking, no.
But I wanted to get clarification.
Yeah, okay, no, that was a joke. I wish it was, because I could start tomorrow if it was me.
You and I have been friends and colleagues for 25 years, and I was concerned about a conflict of interest, and I wanted
No,
clarification.
it's not.
Just to
Okay.
be perfectly clear, the chairman has no financial interest or any other interest in
In
this
that
development.
facility,
nor are you related to probably
right?
potentially to it.
No. You wanna go to item 7, 8, and 9 now? 6? Discussion relative to the,
What we might wanna do is 7, 8, 9, and 10 all relate to the TIF. If we're gonna proceed with the TIF, why don't we go into closed session and talk about that? If you wanna do the TIF, then we can come back out of closed session and take those matters up.
all right. Do you have,
If we go to number 11.
all right. Number 11, discussion relative to the property at 1323 South 65th Street, former Motor Casting Company. Mr. Steele.
This was put on the agenda at the request of Alderman Kaplowski. I'll let Patrick handle that.
We were asked to just kind of bring this to the attention that this property, this foundry is closed. It's around 7.3 acres of land. Some of it is together, and there's some parcels that were parking lots that are located in the neighborhood. There's around 3 different parking lots. So there's around 4 to 5 parcels that really make up the Milwaukee motor casting site. It's over a 100-year-old facility. They have it listed currently with Dickman for around $950,000. The question is, what could this be or what could go there as a site? It abuts the Alice Chalmers manufacturing site, which has recently attracted blast cleaning technologies and Toshiba. It also abuts residential in this general area. It's located not on a main artery, it's just off. And it's a very narrow type of parcel. I think at its widest point, it's, depending on which way is the width, right, is around 160 feet. So in terms of other development sites like Yellow Freight, we had a deeper 250 feet roughly in terms of from the property lines. So when you're looking at redevelopment, what could this be? The current zoning, of course, is manufacturing. Storage, production, if you kept the current facility, cold storage, mini storage, these are things that have become really popular in terms of trying to reuse some of the industrial buildings, etc. It could be another foundry. It could be a brewery or a distillery if somebody was looking to do something creative. I posted some pictures here of Beloit Iron Works and City Foundry in St. Louis where they've taken foundries and kind of repurposed them with the industrial look still present within the property. We're not aware of the environmental condition of motor castings. Not aware of that. If you're gonna redevelop that site, what's the potential? Light industrial, I was thinking small contractors, with smaller buildings, but because you don't have the depth necessary to have large trucks turn around and do the turn radius for deliveries, etc. It could be rezoned and it could be used as residential. With the growth in residential that we see in the neighborhood, this is a site that could be considered. I brought this to your attention just to see what the vision is here for the CDA, to see what they would like to see happen at Motor Castings.
Any questions? Jason?
If you go back to the map, actually the next one. Where, I know they were talking about, with the I-94 project, was having a road that would connect Washington down to Hawley. Is that anywhere in this area, or is that just,
That would be to
is
the
that just north?
the north of this site. In fact, right on the top of the picture.
Yeah, right by
About
next
at
to
the
the
top of
building.
the picture.
Sign in is the DOT sign shop.
Okay.
I'm gonna cut through right through there, but that looks like that's not going to happen.
It would probably come from South 60th Street through the DOT lot and then up and around. Now, that's changed so often, I'm not sure where it would really be, nor does DOT.
Okay. 'Cause I know it doesn't look,
Yeah.
I'm just kinda thinking it could be, you know, if there is a, you know, even a dearth of, a single-family housing, would that be an area that, you know, just,
Could-
can that be cleared and
Depending on
just have,
the state of the environmental.
I'm guessing foundry sand.
I probably guarantee you found.
Yeah.
I know there's a few, there are some Burt's reports on tanks on the sites, but I think most of them have been addressed. But there could be stuff underneath the footings and stuff like that.
Alderman Groh?
Could you just please repeat the price again?
950,000.
Okay, thank you.
I think that I have the listing sheet
It's
right there.
949.
Sale price,
Too
950,000.
high.
It probably costs close to that for demolition. I think we have just shy of that amount, maybe 800,000 estimated.
For demolition?
Yeah.
Okay. Any other, Mr. Clark?
I'm sure Joe Kempen would agree that that's an environmental disaster. But what about the sister company, Gas Tech on National?
That one is a separate listed property. They have it listed for around 470,000,
We'll be talking about that later.
and we have it later on the agenda, I believe. I don't remember if I did or didn't, but it's.
Alderman Chapletsky?
I'd call Patrick up and just ask him, you know, now that it's empty, do we have any desire to do anything here? I'm figuring the thing is polluted as bad as any property we ever went through, for various reasons. And it's shape is so odd, but they own it almost all the way to Greenfield. And just to see if there's any interest, is there anything that we can do with it, you know, and, cause I pretty much, I don't think anybody's gonna buy it, because they figure it's polluted, and it's one of those properties that government's the only people that can come in and clean it up, cause no one else will stick the money into it, you know, to do something like that. So I just thought that, you know, wanted to know if anybody was interested, you know, on, CDA, and Patrick said he would bring it here, so. Maybe just something, food for thought.
Well,
We will keep thinking
keep follow
about-
through and see what can develop,
will
or
keep
what
thinking
develops
about
down the
that.
line, and keep us abreast of what's happening over there.
Particularly, hopefully we'll get the private sector to start doing some environmental testing to see how bad the site is.
Right.
And hopefully it doesn't sit there for an extended period of time. I think that's what Alderman Chepusky is worried about, is nothing may happen to that. Logically, if it was environmentally not a disaster, cold storage could move in there tomorrow, and, you know, but that is certainly an option. But we'll keep this on our radar.
All right, we'll go to item number 12, discussion relative to overhead power lines installation on the property by Weingart Partners Incorporated, the former Yellow Freight Terminal located at 11528 West Rogers Street and 11406 West Rogers Street in the city of West Dallas. Mr. Steele.
Mr. Chairman, we have an agreement with the development of this property to not have any overhead power lines. And I think we discussed this 6 months ago. I don't think we took any action on it, because whatever. The developer initially said that there was no way that they could put they had to put those power lines on, that they weren't given any other option by We Energies. And we talked in our investigation on We Energies, yeah, you could have put it right over here. And that's what we had said that they should be doing. And our agreement specifically says there's no overhead power lines in our redevelopment areas. We're trying to clean up the city, and things should be underground, so they're legally liable to. And at the end, we're gonna ask you to authorize this to proceed to ensure that this gets done with legal action if necessary. And this is a site plan. This is what they currently are, and they should be taken out, and they should be placed across the street where they should have been in the first place. I think somebody just decided to do something as cheaply as they could. Some foreman or somebody somewhere did that, and we pointed out when it went up, and we're hoping that's temporary, because they can't be there, and it was never dealt with. And so we just wanted you to go on record to directing us to take whatever actions are necessary to get those poles relocated. And it would probably cost them about $100,000.
You need a motion?
Yes.
To make a motion?
Second?
Been motion made and second. Is there any further discussion? All in favor?
Aye.
Opposed? Motion carried.
Thank you.
Item 13, discussion relative to outsourcing management and maintenance operations of Beloit Road Senior Housing LLC. Mr. Stevel.
Mr. Chairman, the Community Development Authority is the managing member of this property. The Community Development Authority, in conjunction with the city, obtained a low-income housing tax credits from the state to be able to. We did about a $6 million renovation. Boston Capital bought those credits, so they're technically the 99.99% owner of the facility. The Community Development Authority is the managing member, and you own 0.01%. And at the end of the compliance period, which is 15 years, the CDA will get this building back for $1. And what we're looking at is privatizing. We've privatized the management of it, and now Public Works is doing the maintenance of it, and we wanted to privatize the maintenance of the facility. And this will hopefully relieve Public Works of that obligation, and more privatize it, and hopefully become less expensive. Patrick, you have more comments?
From a city standpoint, does it make financial sense to make this shift?
Yes.
It does. Public Works can't handle it?
Public Works has enough on their plate to do without this.
Alderman Isaac, do you want to go ahead and?
Yes, that's in Alderman Rokes in my district, and I'm sure he gets as many complaints as I do about the lack of maintenance that we do with that place. Public Works ignores it. So doesn't have the manpower to take care of it anymore. So it behooves us to go private and maintain the property.
Alderman Gross?
Yeah, I'm just seeing grass cutting, what about the winter work?
Right now, we have contracted out for the rest of the summer with a private lawn mowing and lawn maintenance service. They'll take care of the shrubs and the mulching and that. 'Cause Public Works just couldn't get to it, and we had a fiduciary obligation to take care of that property, so it's right now, a private company is doing the lawn mowing.
So we are currently have an RFP out, yeah, I'll explain that in a sec. That we have an RFP out for a combined property maintenance and property management service. We had a walkthrough yesterday for firms to come take a look through the facility. And under that RFP, we have the snow removal. At this point, it's still in the city until we are able to contract for an outside service. I do not know what those estimates will be when they come in. We'll have to review that in terms of the service. There's different ways that firms get paid off of management fees and then contracts, et cetera, so we'll have to review that. We did go private on the grass cutting right now, just to get it taken care of. I think Public Works was, a little strapped for staff, so we ended up hiring KEI, and they will be handling all the mulching, trimming, and grass cutting for the rest of the year. Now, when it comes to fall and going forward, we just hope to have that contract in place for the other services. Unit turnover, painting units, lights, one of our calls is light bulbs being replaced. And I just hope that we can do this and also achieve the same level of service that the tenants expect.
Right now, we're just letting you know that the next when are those RFPs due?
I don't have the calendar in front of me. It'll be early July.
Probably in the July meeting, we'll have a spreadsheet of all the prospective.
I believe it ties in right with the July meeting.
Alderman Plesky?
Okay, how much was Public Works bringing in? Because obviously, this entity was paying Public Works for their services, correct?
About $170,000.
$170,000 a year?
Of revenue, yeah.
But they weren't doing the job properly.
They just didn't have time.
Go ahead, John.
When you bring this to the commission next, can we have an analysis from finance of what the benefits and costs are associated with this representation?
Finance will be involved in the selection process, so we'll have all that for you.
Super.
Peggy's smiling already. Any other questions regarding this matter? If not, we'll go to item number 14, consideration for accepting the 2018 Beloit Road audit. Mr. Steele.
Peggy.
Well,
Okay.
I can say is that the audit came back and said that the financial statements were properly stated.
Correct, clean audit, yep.
Yep.
Do y'all have a copy of it in front of you?
Yeah, it's in the,
I was gonna say, there's just a couple things. Yes, the audit, did come through clean, business as usual. Cash flow looks a little stronger this year than it has in the past. Really, that's just a timing issue of the payables. We're paying things more promptly, not as many accounts payables, things like that. We do have, under the assets on page 3, just wanted to point out that operating deficient reserve. I've had questions about that. That's really just a required operating reserve that we're supposed to have because of the agreement, so that money will stay in place. There's a bank account at Tri-City that sits in. Like I said, cash, assets are, of course, going down a little bit because of depreciation. You know, at the renovation point, that was the highest point of value. You will see it depreciated over time. That's to be expected. Down under long-term liabilities, I've also been asked about the loans. Those are part of the deal with Boston Capital. The reason those loans are going up each year from basically 6.6 to 6.7 is because
oh, we don't have to do that?
deferred
So just make a motion to
interest
go
rate,
into
the way
that.
the structures of
Okay.
the loans were set up. So that also is to be expected. Then on the next page, page 4, somebody was just asking about the expenses, operation and maintenance under rental. That's majorly what's spent with Public Works.
Oh, I got that
So
on
the way
mine, yeah.
Public Works charges is whenever they work there, their time gets billed out and benefits get added onto it.
In 2017, that was 178,000. In 2018, that was 153,000. Under general administrative, that's where things like Cardinal Capital's management comes from. So when Patrick is referring to this agreement and how much we might have to spend, it's basically a combination of those dollars. We do interest on an accrual basis. Basically, there's $160,000 that the Light Road Housing LLC pays to the city. About 120 of that goes back to the general fund as a pilot, in addition to the payment of property taxes. So that is a benefit to the city. I think that's pretty much it. Cash flows, nothing really odd. Cash is up, but again, it was a lot of timing issues as far as accounts payable and expenditures. And it shows the operating, change in cash equivalents is 103,000. I would say the norm is more about 40 to 50,000 a year. So nothing really special to report. And then I just, for my own benefit, I looked up the timing of that. This happened in 2012, so basically 2027 is when the compliance period is over. And then the requirements for the LIHTC deals are another 15 years of affordable housing. So basically 2042 is when all of the loans are structured to be paid off.
Thank you.
Move approval.
Wait, 1 second, please. John, you have a question?
Yeah, on page 6, it indicates that the cash from operations is increasing. A bit of a concern, you indicated that some of it was related to the timing of payables. Are we, the biggest category in, that's helping that quote-unquote increase in cash is the less spending on operations and maintenance? Are we deferring any maintenance out there?
No, that's because 17 was too high. We're doing things better, we're recording better now. In 2017, there were some backed up, not maintenance, but deferral, like slow accounting, if you will. I think you
Okay.
can understand that. So the more norm is around the 127,000 for operation and maintenance. So no, they are not deferring maintenance. In fact, I believe there was just a roof that was done recently. And some
We're doing
other
2 a
things.
year.
Yeah,
Yeah.
so,
Okay.
so definitely they're
Okay,
keeping up with
thank
the
you.
maintenance, which is really helpful, should the city get it back in 15 or 9 more years.
Thank you.
And we're funding those roof repairs out of our reserves for replacements that we budgeted for.
Okay, thank you. No further questions? If not, Mr. Clark had made a motion to accept.
Yes.
May I have a second?
Second.
Any further questions? If not, all in favor?
Aye.
Opposed? Motion passes. Now we're going to go to item 6.
No, E, I just, E,
15? Have we done 15?
Oh, excuse me, consideration report on Beloit Road Senior Apartments LLC. Mr. Stevel.
Patrick?
in your file, you have our quarterly report showing that we have positive cash flow on the Beloit Road, and the expenses are in line with budget.
Move approval.
And second?
Second.
Is there any further discussion? Okay, we have a motion to accept the Beloit Road Senior as accepted. All in favor?
Aye.
Opposed?
Just as
The
a
report sounds
caveat,
accepted.
we used to present this monthly, and then you ask us to go quarterly, unless you want to, otherwise we'll keep it at quarterly.
Keep
Is
it
everybody-
quarterly.
Everybody satisfied at quarterly?
And
Yes.
of course, we'll tell you if anything.
Right.
That should be okay.
Thank you, Peggy.
Our comptroller will bring it to your attention if it needs to be seen sooner than quarterly.
All right, now we're gonna go to items 6, 7, and 8. The committee may convene in closed session pursuant to provision, what?
E, other redevelopment.
Oh, you got-
Then we-
Excuse me, I'm jumping the gun here.
Then we'll go to closed session.
All right,
Section
I
E.
got it right here. Item E, consideration relative to the report on redevelopment initiatives. Mr. Stevel.
Patrick has a few things we wanted to talk about,
Just-
just very briefly.
Update, Mandel's going strong, here's an aerial of that one, Ogden's going strong, here's an aerial of that. You can see we got new drone images of the projects ongoing, right over the guys working. You asked about Castech, the property at the 475 is the listing sheet. It is zoned manufacturing, however, in the redevelopment plan for TIF number 6, it says that properties can't do car repair. I know that has come up as a question.
What was the sell price was 450 or
Four
something?
seventy-five.
475.
So that is a unique property. We have been sending it out to different restaurant type of uses and different people who are looking for that type of unique building. So,
What, just quick comment about that building and the power of a redevelopment plan as opposed to a TIF plan. A redevelopment plan, which we put around this area, also allows us to have almost a pseudo zoning overlay. And that's why we could prohibit some uses that we don't want to have in our redevelopment area. Car repair, auto repair was one of them. Sorry about
South 70th Street, the new panels are being, there was some question, were they just painting the outside? No, they were waterproofing the brick underneath, and then they're putting the metal panels on the outside of the building. So up in the upper right-hand corner, I went out there today, and you can see they are installing the new metal panels and bringing the outside of the building. They are quickly going and renovating space on the inside. This is a little bit dated of a photo, but I have seen new photos from Scott Yuck that have showed complete, like, Cream City brick exposed in some of the buildings. The Highway 100 corridor study was approved last night at Common Council. We selected Ginsler, and this group will do a market analysis as well as some planning vignettes of different sites along Highway 100 selected based on what they see as opportunities in that corridor. We picked Ginsler because they have in their house the economic team as well as planning team combined. And they also did work on South 70th Street, the Harbor District, and around the Fiserv Forum. That's it.
Unless anybody else has any questions about these?
Any further questions regards to the items, consideration relative to the report on redevelopment? If not, we will go into closed session. The committee may convene in closed session pertinent to provisions, section 19.85/1/E for the state statutes for purpose of delivering and investing in public funds whenever competition bargaining readiness requires closed session. The committee may reconvene in open session after completion of the closed session to consider the balance of the agenda. We have a motion to go into closed session.
So moved.
Second.